There's evidence that shows that if you wear a mask, it can be irritating, and it means that people sometimes will be more likely to touch their face and nose. So what has changed has been our understanding of when people shed the virus and therefore can be infectious to others. And what we've seen around the world, that there are some people who may not recognize that they are sick or have very early symptoms, or be in the day or two before their symptoms noticeably start, and they can have high viral loads, we call it. So they can have infection in their secretions, virus in their secretions that can infect others. So that is new. That has changed. When we look at SARS, the first SARS outbreak that we had in 2003, when we measured people's viral loads in their secretions over time, it built up over a period of days. So your symptoms started, and then you had your peak viral load around day 5. And we had a very long incubation period, like this one, which is around 2 weeks. When we look at this SARS virus, so SARS-CoV-2, the virus that causes COVID-19, we see a different profile. Even though it's a longer incubation period, what we're seeing is that people can have lots of virus in their secretions early on. So in day 1, day 2, and sometimes even before they have symptoms. It's a little bit different than influenza. So influenza, we know that people shed virus before they have symptoms, but it's a very short incubation period. So people get sick and they pass it on to each other, and they can be sick within 2 to 3 days. So different situation than influenza, but it has led us to think that it is important when those times when we cannot maintain that physical distance consistently, so places like some retail outlets, if they don't have plexiglass barriers, which are very effective at keeping our droplets away from each other, that short-term wearing of a mask may prevent transmission in those situations. But it's not about protecting me. If I am wearing a mask, and we've said this all along, it's about keeping my droplets in. So that is the situations where we might wear a mask if we are either sick and having to go out to get medical care, or in those situations where we might be in close contact with others. And we are now thinking, and this thinking has changed because of the way that we've learned about transmission of this virus, that's probably a good thing for us to do. But we still need to be careful, because it doesn't mean you can get closer to people, because we know that the distance is really important. It doesn't mean you can stop washing your hands and covering your mouth. It doesn't mean you can stop not touching your face. And we have to be very careful, if we're wearing a non-medical mask, that we wear it over our nose and mouth, or else it doesn't keep all our droplets in, and then it doesn't work either. And that we don't fiddle with it and touch it and then rub our eyes, because that's another way we can self-inoculate. So where it works best in those short-term situations, so we don't want people wearing it all day long, for example. It's much more important for us to keep those physical distances. But if we are taking the bus, for example, then it works best if we are both wearing one, because that reduces my chances of coughing on you and your chances of your droplets getting out into the air or the surroundings around me as well. So that's been our change in thinking around non-medical masks, and we try to learn and adapt as we've been going along with this.